We are tracking Ida's path of destruction across Louisiana and Mississippi. Vlad is there on the ground in southern Louisiana. You're a bit north of New Orleans, though, Vlad. Let's hand it over to you.
Yeah, Anne-Marie, Hurricane Ida struck Louisiana, let's remember, as a Category 4 storm, as hospitals and intensive care units remain filled with patients amid low vaccination rates. And of course, we've been talking about this all along, Anne-Marie, the spread of the highly contagious Delta variant of COVID-19. As Louisiana businesses and residents fled the path of the storm, critical care hospitals could not follow evacuation orders. And with no place outside of the storm area to send folks to, we got into a situation that became incredibly difficult for the residents of New Orleans. And that's where we are right now. Anne-Marie, we're experiencing a little bit of a technical difficulty here with our prompters. You can imagine it's not easy to broadcast from situations like this. But let me just remind our viewers what's happening here in Louisiana. Hospitals, specifically in and around the parts of the state and across the South right now, are struggling. So for more on this, let's bring in Dr. Toni Gross. She is here. She is the chief of the emergency department of Children's Hospital in New Orleans. Dr. Gross, explain the situation your emergency room is facing right now.
Hi, thanks for having me this morning. So our emergency department right now is seeing actually low volumes of patients. We are a freestanding children's hospital. We are a 911 receiving facility and part of a trauma program. But because of the storm and because of the difficulty that people have traveling during the storm, the emergency department volumes are low. The hospital inpatient census remains the same as it was prior to the storm. Obviously, it's very difficult for patients to be discharged in the middle of a hurricane. So we are still caring for 120 patients at the hospital right now.
Doctor, we understand that FEMA says millions of residents are without power and that they should be prepared to face power outages for several weeks. Hospitals across the South are also running out of power. They're also running out of oxygen. So ultimately, how is that going to factor into the critical medical care that is needed?
So at Children's Hospital, we made preparations to be able to shelter in place. Across the Gulf South, we know that this is always a possibility. All disasters are local, and so we are prepared to shelter in place to continue taking care of the patients that we have here. We have resources to take care of our staff that are in-house as part of our activation team to care for the patients we have here at the hospital. So we are running on generator power. It is true that the city has no power right now, but we have resources to be able to continue to shelter in place for this week.
And Doctor, what can you tell us about the impact that COVID-19 has had on pediatric patients and the headspace that parents are currently in right now?
Yeah, it's a lot going on, obviously, and the infection control measures that were in place prior to the storm are still in place. That was one little wrinkle to our usual preparations, is when we prepare for extra people to be in this hospital, we had to do it in a socially distanced way. So we made preparations for that. The patient care has remained the same standard of care that we were delivering before the storm is what we're delivering now, despite the fact that we are dealing with COVID-19 right now.
And Doctor, after assessing patients in your care, have you at all noticed a pattern that may suggest where kids may have come into contact with COVID-19?
No, I don't think so. I know when we talked about this last week, we talked about how schools had gone back in. We did not see any dramatic rise in cases admitted to the hospital based on that correlation with the timing of school going back in. I think that in general, the spread of COVID-19 is a community spread. And so the same way that we saw it spread when this started over a year ago, we didn't see kids impacted last year with those first variants of the coronavirus, like we're seeing with the Delta variant. But what we're seeing with the Delta variant is very similar to what we saw last year when we first started learning more about this coronavirus.
And let me get your thoughts, Doctor, on the FDA. They're facing a lot of pressure to provide insight and some clarity on why there is no authorization yet to begin vaccinating children under 12. What potential risks might the agency be looking out for, analyzing when it comes to giving the green light on using a vaccine on children who are younger than 12?
Right. I am cognizant that there is always a consideration for safety first, and that consideration becomes very strong when we talk about children. One of the principles of medicine that we live by is at first do no harm. So we obviously want to make sure that what we're doing is safe, but it is really, really important that children are included in vaccine trials, and that the needs of children are always considered when we introduce vaccines or any other type of mitigation efforts when it comes to emerging infectious diseases. And so my hope is that we will have data that the FDA believes in and will use to authorize vaccines for children who are younger so that more of our population is protected.
And finally, Doctor, before we let you go, I mean, it's important that we continue talking about COVID-19, even in the midst of this devastating storm. But I wonder also what you're hearing or even perhaps seeing with regards to hospital space across the Southeast in the wake of the storm. I mean, we know that many hospitals are taxed right now with a number of COVID-19 patients. Thankfully, the storm has been downgraded to a tropical storm, but there may still be people who require medical attention. In fact, the home that you can see, you might not be able to see, but our viewers can see behind me, the gentleman who lives in that home is caring for his mom who is not well. So I wonder if you could foresee that being a problem even as the storm moves more inland.
Yeah, yes, definitely. And the state and our localities do a really good job of trying to track what we would call at-risk populations. So people who are technology dependent or dependent upon electricity for their at-home healthcare needs. It's definitely something that the community has to consider. It's definitely something that hospitals are ready for. We know that patients who depend on that technology may need to come to a hospital after a disaster such as this one, when if they had electricity, they might not need to come to the hospital. So we're factoring that in, and that's why we have so many staff in the hospital ready to take care of patients who need to come to the hospital for that care.
All right, Dr. Toni Gross, thank you very, very much for spending some time with us. We appreciate it.
Thanks for the opportunity.